Hello and welcome to Seven Sentinels. So we are live now. Hello and welcome to Seven Sentinels. This is Grandmaster class and I am Peter Simon with you, your trainer. Today we are going to have a session, speaking session, insulin injections, speaking sessions, role play not one. Insulin injections, speaking sessions for nurses. This is the patient card and this is the nurse card. So you have 3 minutes to prepare. I've already given you 3 minutes. So now we are going to start the session. This is the patient card. And this is the nurse card. Right. We are going to start the role play right away. So we have Dayana Sheeba. She is from Maldives, originally from Madurai, Tamil Nadu, India. This is speaking role play 001, insulin injections. Hello, Dayana Sheeba.
Hello, sir.
Yes. This is speaking role play number 1. Diabetes insulin injections. Nurse, you can start your role play.
Okay, sir. Hi, good morning.
Good morning, nurse.
My name is Dayana. I'm working as a registered nurse in this community health center. Is this Mr. Lincoln House?
Yes, nurse. This is Mr. Lincoln's house and I am Lincoln. Please come on in, have your seat.
Thank you, Mr. Lincoln. I have been sent by your general practitioner to visit you and inform the change of medication, that is, how to take the insulin injection. Is that okay?
Right, nurse. And I want to ask you one thing. I believe that I have been managing my diabetes well, and I do not want to commence insulin injections.
Yes, Mr. Lincoln, I acknowledge your concern. Try not to worry, I'm here to help you out, okay? I'll give you a proper explanation about the insulin injection so that you can get a clear picture about that. Is that okay?
Why, nurse? I have been managing well with my diabetes diet, medication regimen, and exercise. Everything is going on well. What is the need for me to change this medication plan?
Yes, Mr. Lincoln, I absolutely acknowledge your concept. Okay, despite of your medication and diet and physical therapy, your blood sugar level is not at all maintained. So insulin injection is the only option in front of you. Is that clear for you?
Okay, nurse. Is there any other manner, in a other way possible to manage my diabetes other than insulin injections? Because I'm scared of these insulin injections. I don't want to take injections, please.
All right, Mr. Lincoln, I can understand your situation. Most of the persons are afraid to take injections. I can understand that, but you have to cooperate with this treatment process, because your oral medication, other measures is not at all compensate your glucose level to normal range. So the only option is insulin injection. I hope it's clear for you.
Okay then, nurse, if there is no other possible option, then you can explain me the procedure of taking the injections.
Well, Mr. Lincoln, I appreciate your respectful act, so I can explain you the procedure of self-insulin injection. Is that okay?
Yes, nurse, please go ahead. Come on.
Okay, Mr. Lincoln. So before proceeding the procedure, you have to ready with your medication. Okay, you have to load the medication according to the doctor's order. And second step, you have to select the sites, which is preferred the sites or lateral aspect of arm, lateral thigh, and on your abdomen. But remember that on abdomen, 2 inches away from the belly button, you have to give. Every day you can rotate the sides. Is that clear?
Yes, nurse, of course.
Okay. After selecting the sides, you can clean the area with alcohol cotton swab and pinch the skin and insert the needle on 90-degree angle and push the plunger and insert the needle all the way. Wait for 5 seconds and remove the needle. Okay, is that clear, Mr. Lincoln?
That absolutely fine, nurse. But I have one question. I am not a nurse by profession, and I am not from the medical profession either. So if anything goes wrong, or if there are some side effects, then what am I supposed to do?
I totally understand your situation, Mr. Lincoln. If I would were in your place, I will also react the same way. So there is nothing to over concern about this. Okay, on initial days, I'll be with you. Okay, I'll demonstrate you and you can practice on initial days. After 3 days, you can give yourself. Is that okay?
Absolutely fine, nurse.
Okay, Mr. Lincoln. And I would like to tell you that after injecting insulin, you have to dispose the needle in a proper container, which will be provided for you.
Okay, nurse. Right, you have told me regarding the location, changing the place. But what about the injections? Should I, use the same needle? Okay.
Well, Mr. Lincoln, your question is reasonable. Let me explain you. You can use the syringe and needle every time a new needle. Okay.
Okay, what should I do with the used syringes? Can I use them again, or should I throw them off?
Yes, Mr. Lincoln. As I mentioned that after using the syringe and needle, you have to discard in a proper container. Okay. Once it gets filled 3/4, you can inform us so that we can replace with the new container.
Okay, nurse. Is there anything that I should know? Do you have any materials or brochures or pamphlets or any papers related to this injections, insulin injections and diabetes? I want to know more about them, nurse.
Definitely, Mr. Lincoln, I'll provide you a leaflet which contains the details regarding the self-insulin administration so that you can go through it. And if you have any doubts, you can ask me. Is that okay?
Thank you very much, nurse.
Okay, Mr. Lincoln. Do you have any other concerns?
No, nurse. Thank you very much. You have given a detailed information, and I really appreciate your kindness. Thank you very much once again. Have a nice day, nurse.
It's my pleasure. I wish the speedy recovery. Have a nice day.
Thank you, nurse. Thank you very much.